We go now to our reporter Laura Windsor, who has information on breast reconstruction.
According to the American Society of Plastic Surgeons, there were over 86,000 breast reconstruction surgeries done last year. It's a surgical procedure to rebuild the contour of the breast, commonly after cancer surgery. We spoke with Dr. Anil-Punjabi at Redlands Community Hospital, who gives us more information on the surgery to help women improve their self-image.
The patients that we see for breast reconstruction are the patients who have had breast cancer. Breast cancer will affect 1 in 8 women in the United States of America. Today, we have many technologies available surgically as well as medically to treat this scourge.
We asked Dr. Punjabi when a breast reconstruction surgeon would become involved.
We like to get involved at the time when the diagnosis is made, because patients are so devastated by the news and are so affected that we as plastic surgeons can be the harbingers of hope, because we are the ones that will come back and actually make them whole. The reconstructive aspect of it depends on many factors, including if the patient, what stage the disease was when the patient was diagnosed at, whether the patient is going to need radiation, and whether the patient is going to have further surgery. In a low-grade, low-stage breast cancer, reconstruction can be accomplished at the same time as a mastectomy. The process of reconstructing a new breast takes several months to a year to complete.
Dr. Punjabi, when a woman needs breast reconstruction, does it involve one or both of the breasts?
It depends on the situation. If a patient has had a mastectomy on one side, then the breast that was lost to cancer is reconstructed, and then the opposite breast is usually balanced by either having an implant placed or a lift performed at the same time so as to match the reconstructed breast. When the reconstruction is for both sides, then of course it's easier to match the two, because we are reconstructing and starting from scratch on both sides, and we match the two breasts as we go along.
We asked Dr. Punjabi if breast reconstruction is covered by insurance.
Reconstructive cases, they are covered 100% by the insurance. The insurance will pay for not only reconstructing the breast that was lost to cancer, but any other modifications that have to be made on the opposite breast in order to provide a balanced, aesthetic, and symmetric reconstruction. The insurance companies will pay for that.
Dr. Punjabi, tell us how rewarding it is to be a breast reconstructive surgeon.
It is the most gratifying feeling to make somebody whole again. We actually have a celebration of survival fashion show that we have that is sponsored by Redlands Community Hospital for our breast reconstruction patients, which is a fashion show which is modeled by our patients who have had reconstruction done and have survived and thrived to celebrate their survival.
If you need breast reconstructive surgery, you and those close to you should talk to your healthcare team about any questions and concerns you have about this type of surgery. For the American Health Journal, I'm Laura Windsor.
Do scents boost energy, mood, and memory? True or false? The answer when we return.